Yes, sir.
Yes. Would you comment on the current situation in military and veterans hospitals?
Yes, sir. Thank you for the question. What about the situation in our military and veterans hospitals? I'd like to begin by saying that I think there's many of us in this room know that some of the most dedicated and wonderful people in America are the doctors and nurses and many people who take care of our veterans. Having said that, what happened at Walter Reed is an inexcusable disgrace. And what we are finding out in some other VA facilities is an inexcusable and appalling disgrace. I was in Nashua a few days ago at the occasion of opening a veterans home for homeless veterans. It was a wonderful occasion. It was the city of Nashua, private-public partnership, etc. By the way, there's a waiting list of 200 for this 20-bed home, so don't think that it's the answer. But I had to read this, and I think it's really incredible when you think about it. George Washington, 1789, George Washington said the following: "The willingness with which our young people are likely to serve in any war, no matter how justified, shall be directly proportional as to how they perceive the veterans of earlier wars were treated and appreciated by the country." That's why this is so important. George Washington, 1789. So, I think that there's a lot of things that need to be done. One of the things we ought to consider, well, one of the biggest problems is the transition and veterans care. It's not seamless. There's all kinds of problems associated with that. But should we look at, as you know, military and their families today are eligible for a thing called TRICARE, where you just go into a hospital, you go into a hospital or a doctor or a clinic and you get treated. I wonder if in the short term we ought to make veterans eligible for that kind of care as well. To just say, okay, you're a veteran, you'll get the same kind of access to health care as the TRICARE system is. I think that's something we ought to think about seriously. But because there's straight talk at these meetings, I have to tell you, I'm a member of the Armed Services Committee. I've been on the Armed Services Committee 20 years. I have been to Walter Reed many times. I've been to the hospital to see the inpatients there, and I've been to the rehab facility. I never knew about that building. It's my responsibility for not knowing so, and not knowing about it, and I'm to blame.